on the News Channel 5 network. This is Open Line.
Hello, everyone. Welcome to Open Line. Good show tonight. Very important show. We are talking about the coronavirus and what you need to know. And certainly, there have been remarkable developments over the course of the last 24 hours, the last 48 hours. We are very happy to have with us Dr. John Dunn. He is the state epidemiologist with the Tennessee Department of Health. Dr. Dunn was with the governor today as he declared the state of emergency. Dr. Dunn, thank you for being here.
Yeah, thanks, Ben. Thanks for having us.
And answering questions, because there are a lot of questions that people have. Just today, the SEC tournament canceled, March Madness canceled, basketball, hockey, baseball suspended, colleges shutting down. I've heard people say, are we overreacting? So are we? Are we overreacting?
Well, I think what we want people to know is that we're taking this situation very seriously. And we've had other outbreaks in the past that have spread across the United States. I mean, people may remember things like West Nile virus and Zika virus. So when these types of outbreaks occur, of course, we're very concerned because people's health is so important. And so some of the things that are happening are out of great concern, and we understand that. And businesses and events and schools have to make decisions that are based on their local situation. So we understand completely, and we really just want people to know that it is serious. We want them to take precautions. The level of concern, I think, is appropriate.
The level of concern is appropriate. What is the death rate with the coronavirus? Again, some say it's like the flu. It's maybe a little worse than the flu. Let's ground us right now. What is the death rate?
Yeah, Ben, I wish I could give you a really firm answer about that. I mean, a lot of the information that we have right now, of course, this COVID-19 disease, people have referred to as novel coronavirus because it's new. So we don't know a lot about it. We've only known since really the end of last year about this disease when it was spreading in China. So a lot of the information we have is from China. We don't have a lot of information from the United States right now where we may be able to get some better estimates, but we're probably in the range of 1% is what we're hearing. Maybe a little higher than flu, but not as high as some of the other diseases that would be diseases of great concern.
What is your estimation of how long this will last? Is it like the flu when in the warmer temperatures it seems to go away? So what is your estimation of how long this will last?
Well, I really don't know. It's been going on in China for 4 months now, maybe longer. So I think we could at least anticipate that long. There's countries that are farther ahead than us, so that's one way that we can kind of measure how long we think it's going to last. You mentioned seasonal flu, and that happens in the winter. In the United States and North America, it happens in the winter, and then it goes to the southern hemisphere for the winter. So it kind of moves back and forth for influenza. With coronavirus, COVID-19, we really don't know. We don't know if there's going to be a seasonal pattern to it. So I think we need to prepare for a long haul. We'll hope for the best, but we're going to prepare for a long haul that disease might continue to spread in our communities and last months.
Could last months. Where are we with testing right now? In the state, how many people have tested positive for this, and kind of where are we with testing?
Yeah, the number is easy to find. It's on our website, which is www.tn.gov/health. It's posted every day at 2 o'clock. The current number is 18 cases. So there's good news on the testing front. Our laboratory has kind of stepped into the gap for diagnostic testing, and this is not something that our healthcare delivery system is prepared to turn on immediately. So what our state public health lab has done is work closely with CDC. We were one of the first labs to get the testing up and running. So we're really pleased about that because we were able to identify some early cases. What has happened this week is that commercial lab testing, LabCorp and Quest have started doing nationwide testing. So what that's going to enable us to do is kind of get out of this intermediate phase where public health has stepped in and tried to fill the gap with testing and clinical advice and get our providers and our laboratories in the community kind of back to our normal healthcare system where doctors in the community are taking care of patients and they're sending off tests to the normal labs that they use.
You said there are 18 cases, and I think we can break that down, of 6 in Davidson County, 1 in Knox County, 2 in Shelby, 1 in Sullivan, 8 in Williamson. All right, so that doesn't sound like a lot of cases, but there haven't been a ton of tests. Do you feel like the reality is there are more people out there with coronavirus?
We do, and that's something that we recognize in our other reportable diseases. Oftentimes what we learn about are the people that were sick enough to go to their doctor, the doctor decided to do a test, and we have a result, and public health learns about that. But we know that there's a lot of other people in the community that may have a very mild illness and may not seek care. So we don't often learn about those people in the community that are ill. So that you can kind of think of that as an iceberg. So we kind of see the tip of the iceberg, but we know there's more illness below the surface. So yeah, we anticipate that there are other cases, and that's to be expected.
How are we going to find those cases? Do you think now that private companies are going to come in and start testing? There's been some criticism about the fact there weren't more tests done through the government. Do you think there was a failure here in testing?
I don't think so. Our lab has been working 7 days a week, doing as many tests as they can have the capacity to do. That's one of our roles, is to step in when a new emerging disease is occurring and provide that testing capacity initially until the healthcare system can get up to speed and start providing the service and capacity like it normally does for other diseases.
So you think now what's going to happen? Is it true that private companies are now coming in? Private industry?
They are, and we've already been receiving some results, so we're pleased about that. There are also some larger medical facilities that have developed testing, and they're testing as well. So we're going to, this is a reportable disease, so we'll be receiving the results from the private companies and from any other testing that's done in the state. We'll be receiving those positive tests and tracking the rates of disease.
We've heard that there's certain guidelines that you have to meet. Say somebody feels like they're sick, they say, I would like a test, and what they're told is you have to meet certain guidelines. Some of those guidelines have been pretty strict, and there haven't been tons of tests done. Are the guidelines now going to be loosened? Are we going to start seeing more people get tested more easily, more quickly?
We are. Some of those initial guidelines were the guidelines that CDC gave us, and they were based on travel. Of course, people know that this started in a particular province in China, and a lot of the early guidance was based on the disease transmission in that country. And the testing was very limited to start with. CDC was trying to develop the assay, get it out to state public health laboratories. So we were trying to be judicious and look for the highest probability cases so we would know when it showed up in the United States, so we could start our preparedness and mitigation activities to prevent illness long term. So yeah, the criteria have certainly loosened, and with this additional lab testing that's available, what we are messaging now is that people's primary care providers are going to be the place they should go, and that's typically the case. There's a doctor-patient relationship. They are able to many of them will be able to get the test easily through the commercial labs, and we want to help direct people back to their care provider so they can get the best care available and get testing done.
So you say many people will be able to get the test easily through commercial labs. When will that happen? Are you seeing that happen next week, tomorrow? When will that happen?
We're seeing it happen right now. As I mentioned, we're seeing some lab tests come in from commercial labs, so we feel like that's a really good thing. That's good news this week, that we have that lab capacity and that the doctors in our medical care community are going to have that test accessible to them more widely like they normally would for other diseases.
As we see more widespread testing, what do you expect to see with the numbers?
Well, I think we're going to see the number of cases go up pretty quickly as that test gets rolled out to the entire medical community, and we have national testing on board. We're going to see that in Tennessee. We're going to see that nationally. A lot has been said about containment activities, so trying to control spread. That's just one aspect. We know that This is a highly transmissible disease, like most respiratory viruses are, like the flu, for example. It's fairly easy to transmit, and so we expect there to be transmission in the community and have a larger number of cases.
So if somebody, let's say there's somebody out there right now, the primary symptoms are a fever, dry cough, shortness of breath, is that right?
That's correct, yeah.
So if somebody has a fever, high cough, shortness of breath, what should that person do?
Well, we want them to contact their provider, their normal medical provider, and talk to them about the symptoms. We would prefer that they contact them ahead of time so that the provider knows. They'll take some precautions when the patient comes in to the facility to protect other patients that might be in the office. So that's what we recommend, people that have those symptoms to consult with their provider, to call ahead before they go for care.
Call their doctor. If they have those things, which again, it's been widely reported, shortness of breath, coughing, fever, should they go to the emergency room?
No, we feel like in the emergency room is for emergent situations. We think of car wrecks and those type of things, heart attacks. So if people are feeling, having that mild illness, and that's an important point, that a pretty large proportion of these cases, maybe as much as 80%, 4 out of 5 cases have a mild illness, that they really ought to be going to their routine provider, because we don't want people coming to the emergency room and slowing down care there for more acute type situations.
What have you seen as far as the incubation period and that kind of thing? I mean, again, we've heard that you could not have any symptoms and yet still be transmitting the disease. Do we have a better understanding of how long that period is, and how long, if you do go into isolation, you need to stay into isolation? Go through, I guess, some of the time periods here. Yeah,
so what we know so far, and again, a lot of it is from the work that's been done in China. The average incubation is about 5 days. You mentioned about people not showing symptoms. That's not the way that diseases are typically spread. So I know that causes a lot of concern, that could somebody be walking around with COVID-19 and spreading it to others and nobody knows. We don't think so. The way that respiratory viruses are spread, and I was talking to a colleague at CDC today about this, and it's spread through droplets. So it's primarily when people are coughing, you mentioned cough as a symptom. When people are coughing, sneezing, there are droplets. That's the way respiratory viruses like COVID-19 are spread. So is it possible that someone could be infected and only have very mild symptoms? Certainly, but those aren't the people or the cases that are going to be contributing largely to community spread.
We've seen Vanderbilt is adding on out there. It's in a parking garage. They're adding on some area out there. Where do you think we're going to be in a week and in 2 weeks? What is going to be happening? What do you expect?
Do you mean in terms of testing, or
testing, and as far as just the number of people that are sick?
Yeah, that's really hard to make a prediction. I guess what I would say is that we want people to expect that the number of cases is going to increase very rapidly. We know that based on the disease progression in China, that some of our older populations, people that have immune compromise, kind of medically fragile folks, those are some of the populations that we're most concerned about, and we want to protect them as much as possible. So we're going to expect to see more cases rapidly. Some of those, a proportion of those, will require hospitalization, and we hope not, but we really should expect that in some of our cases, unfortunately, we're going to have some deaths.
How are children impacted by this? Are we again? We've heard that they're not impacted. Are there cases where they're impacted? How are children impacted?
Yeah, that's something that we'd really like to know more about, and it's curious. I mean, this is a new disease, a novel coronavirus, and what we understand so far is that children are not a heavily impacted segment of our community. So in many ways, that's a good thing, that they're not. So we're studying that. We're in the United States. I know CDC is doing a number of things to try to understand disease within different segments of the population as we have more cases in the U.S.
When you talk about testing, I'm going to ask a couple more questions, then we'll open it up to people can call in. But when we talk about testing, there's molecular testing, is that right, and culture testing. We've been told molecular testing is faster and more accurate. Is that true?
Well, the testing that's being used for the diagnosis of cases is molecular testing, and it's a test called the polymerase chain reaction. People just refer to it as PCR. And basically, it looks for the genetic material of the virus, and it amplifies it. It uses some techniques that amplify it, and then can detect those specific pieces that indicate, yes, this is the COVID-19 genetic material. And that's the test that we're using in our lab around the country. There probably are some culture methods that are available, but those aren't the tests that we're using for our diagnostic capacity.
Here in Nashville and Tennessee, do you expect that there would be a place where somebody could drive up and get a test?
Well, you know, we're hearing about a whole range of different things around the country, and hospital systems and providers are trying to deal with the concern and the desire to get testing. So I think that's certainly a possibility that we could see things in Nashville. We're hearing about other medical systems working together with their partners in the community to try to develop strategies to help people be seen, help them get tested if appropriate. So we certainly would expect to see some of those strategies at the local level.
If that happened, that's because, again, a private, I guess, hospital wants to move in that direction. Is that right? It's kind of up to them. It's not like the state is going to open up something, but it would be more of a private entity. That's
right. And you know, we don't have any plans to do that at the state level, but we are working very closely with our hospital systems. We have a public health emergency preparedness program that has a hospital preparedness component. We have healthcare coalitions, and frankly, our regional and local health departments, like the Nashville-Davidson County Health Department, work very closely with the facilities in their jurisdiction, and they're partnering with them to make those decisions and set up those kind of facilities if they can to help ease the burden and get answers for people.
All right, we're going to take a break, and then I'm going to start taking calls. What is the bottom line? I'll start taking calls right after this break, but what is the bottom line that you want people to understand? Clearly things have increased dramatically. I think some people are kind of surprised. What message do you have? What's the bottom line at this point?
Well, I think one of the key messages, and this is something that that our governor has talked about, you know, some of the most simple measures that we can recommend to people about covering your cough, about staying home when you're sick, about avoiding large crowds while this COVID-19 is in the community. Some of those most simple messages are the things that we always tell people, but we really think that those actions are going to be the things that incrementally help slow disease and keep people from getting sick. So we really want people to be aware of those simple measures and to take care of each other in the community as well.
Dr. John Dunn with Tennessee Department of Health. We're going to take a break, and then I'll start taking calls. We have a bunch of calls. Take calls. Be back right after this.